my name is Carissa. I'm going to be doing an NG tube insertion. The first thing I would do is verify my doctor's orders that I have orders for replacement of an NG tube, which I do. I'm going to be inserting a 14 French NG tube for irrigation purposes and suction. So first thing I would do is I would go and gather all my supplies. I need a towel, an irrigation syringe, and sterile water, some extra water in case I need a cup to drink, a 14 French NG tube, the lubrication, gloves, tape, pen light, and marker. So I'm going to go ahead and gather all my supplies, and then we'll go into my patient's room.
Come in.
Hi, I'm Carissa. I'm your nurse today. I'm here to place an NG tube. Can you please give me your name and your date of birth?
Kelly Jackson, 01-10-94.
Okay, let me just verify with that with your bracelet, and everything matches. Good. Perfect. Do you have any allergies?
Nope.
Have you ever had an NG tube before?
No.
Okay, well basically it's a tube that goes through your nasogastric cavity, through your nose and into your stomach, and we're going to use it to irrigate some of the stomach contents out, okay?
Okay.
Alright, so I'm going to go ahead and do my hand hygiene, wash my hands, apply some gloves. I'm going to position the patient. I'm going to move them into a high Fowler's. Good. I'm sorry, I'm going to have to take your pillow away for this. I'm going to lay a towel across the chest, just in case we make a little bit of a mess. Alright. Go ahead and I'm going to check my kit. It's intact. It's not expired or anything. So I'm going to go ahead and I'm going to start by inspecting the nares for patency. Can you breathe in for me? Good. Occluding the nares and having them breathe in. It looks like the left nair has more patent. It's got more airflow, so that's the one I'm going to use. I'm going to go ahead and I'm going to take my tubing, and I'm going to measure from the tip of the nose to the ear down to the xiphoid process. And then I'm going to go ahead and I'm going to mark it with my marker. And then I'm going to go ahead and I'm going to put my lubricant jelly down, get it ready. I've got my tape ready. I'm going to go ahead and lubricate. And I'm going to get, okay, I'm going to need you to tip your head back for me. And I'm going to go ahead and start to insert. So it's going to be a little uncomfortable. As I get so far, I'm going to check for coiling in the back of the throat. No coiling. I'm going to keep advancing. Tip the head chin to chest. Can you swallow for me? Swallow, swallow, swallow. I'd give them a cup of water if they needed it. And I'm going to advance all the way to my tube so I get to my mark. Okay, go ahead and relax your head. I'm going to temporarily put some tape and secure that while I check for patency. I'm going to go ahead and I'm going to draw up 30 milliliters of air. I'm going to connect it to my tubing. I'm going to aspirate a little. I get stomach contents, which I think I do. Some hospitals' policy is to test using pH, others is air bolus. I'm going to be using air bolus. I'm going to go ahead and inject the air while listening. I hear some swishing sounds and some gurgles, which tells me that I am in fact in the stomach. But some hospitals may want a more exact, and that would be X-ray. But I'm going to go with my verification. So I'm going to go ahead and I'm actually just going to secure this to the nasal passageway. then I'm going to detach the syringe, drop 30 milliliters of sterile water. I'm going to inject. I'm going to drop as much as I can back. I've got about 20 milliliters, so I've got about an input about 10 milliliters. I'm going to disconnect it and go ahead and hook up to my suction. I would take and with a safety pin and rubber band and having the patient turn their head all the way to the right, I would fasten this to their gown. That way they'd have full range of motion of their head and not worry about pulling it out. I would check and see, are you okay? You comfortable? Can you talk? Okay? Good, they're talking. Everything's good. I'm going to go ahead and get them comfortable. Put your pillow back. How's that? Good. Alright, I'm going to lower the head of the bed to semi-Fowler's, about 30 degrees. Leave them there. Do you need anything else? Are you comfortable? If they don't have, they don't need anything, they don't have to use the bathroom or in a comfortable position, I will then finish cleaning up the rest of my area. I will take off my gloves, wash my hands, and I will document. It was a 14 French, inserted an NG for suction. It was attached to lower intermittent suction. There was 10 milliliters of input and no output, and that is all. Thank you.